I am here with Ilker. His company is named PONS, and we're at the HITLAB Innovator Summit. And you just finished up a presentation, and you've kind of hit on something I think that a lot of people that are looking at using new technology to advance things. You're taking an established tool and making it work a whole lot better.
Yes, that's correct. And what we're trying to do is point-of-care ultrasound is an established technology. It's a small handheld ultrasound device. You can connect to your cell phone or your tablet, and technically you can collect ultrasound data anywhere you go. But then the challenges associated with ultrasound in general, especially with these smaller units, because anytime you shrink an imaging modality, you lose the quality of the data.
Right.
So, and with ultrasound, you already start with a bad quality image. So we are basically overcoming that challenge with our patented technology. We're improving the quality of ultrasound data so that early stage disease can be imaged with ultrasound. And we're achieving that by collecting data outside the hospital settings, either at home, walk-in clinics, doctor's offices as well. So we can monitor patients who are in the high-risk group for chronic conditions, such as breast cancer, which is our initial focus.
The reach of this is intriguing to me because, I mean, one of the challenges of modern healthcare is getting it to people, especially in more remote areas.
Yes.
And this seems like this is one of the solutions.
No, that's a good point. I mean, we call them the healthcare deserts, right? So these basically remote areas, the nearest hospital is a couple hours away. And then if you're talking about monitoring patients more frequently, you cannot basically ask them to drive 2-3 hours, go to the hospital and get a scan and drive back. Or even in city centers for breast cancer, women who are in the high-risk group, they schedule their appointments, but most of the time they cancel due to family reasons or not having enough time. And then that prolongs the frequent monitoring aspect. So we want to overcome that challenge by really bringing ultrasound to the community level with our technology and solutions.
This is a pretty clever idea. Is somebody's stroke of genius or something that you gained through an experience, or how did it come about?
I'm an engineer, PhD. So we talk with clinicians. Clinicians are the main difference makers. So we were talking with a friend of ours, and then he mentioned that our initial focus was on brain injury. But then the idea was like, why don't you guys bring this technology for monitoring patients, which is the needed technology? Because in healthcare, when you think about it, we collect a lot of data inside the hospital setting. So we have data from healthy people to do their regular checkups, or somebody's admitted with a pain, they're diagnosed with late-stage disease. But the data in between that two stages, from healthy to disease, is missing. Those are the people who are in the high-risk group that reside outside hospital settings in rural areas. Or they need to be frequently monitored. And then the only way to collect that missing data is through point-of-care ultrasound, if you can improve the challenges with that modality.
That seems to be the big challenge, especially with new devices, is they gather great data, but it's really hard to take it and move it where it needs to go to be interpreted and be useful.
Exactly, and that's the ultimate challenge, right? If you can catch the disease at an earlier stage, most of the chronic conditions are manageable. But if you go to the late stage, then it advances to other regions in your body as well. It starts with breast cancer, goes to liver, and at that point, it's rather than basically, it's not helpful, right? So, and then as you mentioned as well, like we have an aging population. A lot of these people would like to age at home. They don't want to travel a couple hours to the nearest hospital. So if you can bring technologies that can allow you to collect data from their comfort of their home, scan them once a month or every other month, monitor them, and then we can provide the improved quality care they need.
So where are you with your company's development? What do you need?
Yeah, we're doing pilot studies right now with major healthcare centers like Mayo Clinic as well. I was a prof at Rutgers, so our basic technology came out of there. We're doing pilot studies with Robert Wood Johnson Hospital. We are obviously, all these pilot studies require more personnel, so we're raising our seed round currently. And we're also happy to start new pilot studies with research hospitals who have hospital at home services, so that we can integrate our solutions to their offerings.
So what does it mean for you to be able to come to the HITLAB Innovator Summit and tell your story, and and what kind of reaction are you getting?
No, we're very happy with HITLAB. We joined this 2 summits before, and the main idea was networking, meeting more people and investors. What we met, basically people from NIH who basically played a significant role for us securing an NIH grant that will be announced soon. We also started basically networking with clinicians around the New York City area, and as well as some other colleagues who are basically developing different AI solutions. So the feedback has been tremendous from our part. We won the ARP, HTech ARP challenge. So that is also basically allowed us to enter ARP's cohort group as part of the accelerator. So we were happy about that as well. That again, all this happened through our connections with HITLAB, and we are very happy. And then I talk about HITLAB anywhere I go with small startups or other startups who haven't heard from HITLAB before.
Sounds like you have some momentum going.
Yeah, we were very happy. I think finally we started our company around like 2022, which is the curve of basically starting the startups. But we are very happy right now with the progress we made. Everything is coming together. So hopefully 2025 will be a very good year.
Well, Ilker, congratulations on your success so far, and we look forward to hearing great things from you.
Thank you so much, and I look forward to seeing you again in HITLAB.
Thank you.
Yeah.